Hello all. I want to speak to you today about something that utterly frustrates me. Being in this in-between space, this world of naturopathic medicine, where I'm kind of caught between two poles, especially doing mental health. So that space would be, okay, so there's conventional world over here, where pharmaceutical, drugs, diagnosis, overdiagnosis, overpathologization occurs, right? Where we're very quick to label something as depression when it's something like grief or a normal reaction to an abnormal stress. Right, that's conventional world. And then the other pole of what I would call the anti-psychiatry movement. A lot of which resonates with me. I mean, I've been to conferences put on by what I would refer to as the anti-psychiatry movement, where there's kind of this backlash against pharmaceutical drugs, which understandably so. I'm completely frustrated with pharmaceutical drugs, and I don't really utilize them in my practice at all. So, yes, there are lots of pieces that resonate with me. But I hate the cliche, but part of it is this throwing the baby out with the bathwater. So the anti-psychiatry movement sometimes goes so far as to say, okay, you're having a spiritual crisis, you're having this normal Kundalini experience, you're having some kind of whatever it is you have going on, it can be understood from this perspective of normal. Most of the time I think that works. And I think that's probably, I mean, we have so much overdiagnosis going on and so many people being slapped on drugs. And I think it's ridiculous. And at the same time, I am the sister of a brother who had bipolar 1 disorder and died of it. And the first time he went to the hospital, when he was in a mixed manic state, the psych evaluator said, this is the worst case of bipolar 1 I've ever seen in my life. I mean, there was something going on. He had something diagnosable. Now, were there other pieces? Was he having a spiritual crisis? Was he in need of support? Did he need coping mechanisms? Were there other things, family things, stressors going on? Yes, of course. And at the same time, I think there was something ultimately diagnosable. And so this kind of brings me to the space of, as a naturopathic physician, I'm caught between these two poles. Not everything is diagnosable, not everything is pathology, but neither is nothing pathology, right? To borrow the book by Thomas Szasz, The Myth of Mental Illness. I think sometimes there is actually something we might call mental illness, not to say that it has to be there permanently, that it can't be treated, that it can't be moved away, that its roots are always biological in origin. No, in fact, most of the time there are multiple factorial contributing factors to sound redundant. Okay. Lots of things feed into a diagnosis. I don't think everybody needs a diagnosis, but sometimes a diagnosis is actually helpful. And that's, I don't want to go over here and say you are your diagnosis. Neither do I want to say throw the baby out with the bathwater, there is no such thing as mental illness. No, sometimes it's not so attractive to kind of be in the middle, right? You can't have this reactionary, polarizing position, and yet that's very much where reality is a lot of times. So how I use diagnosis in my practice, I do something called homeopathy. I'm not going to get into it on this video about what homeopathy is, but suffice it to say, part of doing homeopathy relies on understanding someone's experience of whatever it is they have going on. So I have to understand their pathology in quotes, right? Or what would fit this picture. And then I have to understand how they vary from that, because that's their unique experience. So that's my goal. I use my diagnosis as a way to guide me to what's unique about their experience. Not as this static rubber stamp that's gonna follow them the rest of their lives. And in fact, my goal is to cure it, to help it move away, so they don't have to be defined by this. But I still use it as a guide so that I can understand what to expect with that diagnosis, and therefore knowing what's unique, because the unique piece is what's important for homeopathy. And then also, how do I prognosis, right? If they come back and they're doing better than what the prognosis of their pathology or diagnosis suggests, then we're on the right track. That I use it to track where we're headed, not as this set in stone piece that's never going to move. No, my goal is to actually to move it, to shift things, and therefore to help them get to a different space. Is it biological? Maybe part of it. Is it spiritual? Maybe part of it. Is it mental, emotional? Is it trauma from childhood? Part of it. But part of it doesn't matter where it comes from. The point is, what's the grid? What's the diagnosis, so I can understand how they're varying from it, and therefore where to go. So, yeah, caught in the middle. I don't really care. I'm not on any other of these polls. Thanks for tuning in. I would love to hear your comments, questions, concerns, etc. Okay, tune in next time.